each time it's purchased by a research institution, you can count on $40 hitting your bank account. And it doesn't necessarily matter if you are somebody who is suffering from a rare or debilitating condition that is interested in being part of the clinical trial landscape, or you're somebody who might be on the other end of the spectrum, a college kid that's looking to earn some extra income passively by just contributing their data and having a clean bill of health. All data is welcome and it's all useful when it comes to translating into different types of health outcomes.
Welcome to Super Entrepreneurs Podcast. I'm your host, Shahid Durrani. Today we have with us Britt Gottschalk. Britt serves as the Chief Executive Officer for Geno.me, so GENO.me. Britt's role focuses on advancing the mission, work, and overall vision of the company. She is a Milwaukee native and has 15 years background in healthcare services and communication. Thank you so much for joining us today, Britt.
Yeah, thank you for having me. It's a pleasure to be here.
My pleasure. Your background is quite dynamic, from healthcare, communication. Having that type of a diverse experience, it must have influenced your approach to this startup.
Oh, yeah.
Yeah. So is there any specific aspect of this startup where the diverse knowledge or experience helped?
Oh, yeah, definitely. Let me back up here. I went to school originally for psychology. I was a big fan of understanding people, processes, and how to make those all flow together. And in my journey of my career, I didn't start out wanting to start a business. I started out wanting to help people. And I did that primarily through consulting. I think in order to understand which problems you want to solve and how to best solve them, you have to be in the work world for a little bit. You got to work for other people. You got to wet your beak, so to speak. And so I did that. And I worked in a bunch of different industries ever since I was age 15, all the way to being able to start my business now. And I think that if I did not do that, did not become a Jill of all trades in all these different areas, I wouldn't have had the acumen or the knowledge to be able to understand what problems I should be trying to solve. If that makes sense.
Definitely. Because it's a unique startup. And yeah, your focus is on empowering individuals to control their health data, or maybe we can clarify or discuss that a little bit more about actual data. Who has the control? Is it the person who's signing up has the ultimate control, or is the data being shared anywhere else? And can you also elaborate on the significance of having this data in the healthcare world, and how your startup is contributing to this shift in this paradigm?
Sure. Yeah. This is my second company I started. The first company I started was a consulting firm, and that really gave me the foundation to be able to say, all right, what are some of these bigger issues, especially the ones that had reared their head during the pandemic? And health care, health data accessibility, that was one that I kept running into, and I was talking to my advisors and clients at the time. So started Geno.me, and the idea behind it was to empower people to own their health data and share it with the organizations that could do the most good with it, whether that be clinical research organizations conducting trials, different types of treatments, longitudinal studies, whatever that might be. And so coming up with a model that we have now at the company. So it's a marketplace model, B2B2C, it's B2C and then B2B. And it starts on the end of the contributor. So that's somebody like you and I that decides that they want to share their health data. That health data being very specifically their electronic medical record or an EMR, and their genetic and genomic data. So in your EMR, that's something everybody pretty much has when you go to the doctor. So it's the history that you have in your Epic My Chart or your Cerner Millennium account. And then for a genetic and genomic report, that's the stuff that you'd get after you do a 23andMe, Ancestry.com kit, or even a whole sequence genome kit that you might get from a specialist. So we aggregate that data, and we make that available for research institutions to purchase. And whether that be for screening or conducting clinical trials or for any type of study or to supplement existing data that they already have, that's what they use it for. And then once they purchase your data, you actually get compensated for it. So we've created this end-to-end solution that allows everyday people essentially to become part of this medical research process that a lot of times people didn't know they could become part of. So yeah, that's pretty much what we do in a nutshell.
It's exciting if you think about it, maybe in 50 years from now. What kind of impact would this type of data have on the healthcare of the future if more and more people accept this concept?
Yeah, I think there have been quite a few countries and even states that understand how valuable sensitive information is and that it should all ownership and rights should belong to the individual. And what we do is we allow people to get engaged with that world, whether that's through sharing their data de-identified or consenting to being recontacted for clinical research purposes. And when we're looking at the specific data that we use in our platform, the ones that we transfer, it centers primarily around either like pharmacogenomics, individualized medicine, and basically personalized healthcare, right? And we're talking about the future of being able to look at somebody's genetic makeup, look at those environmental factors that impact their health, and being able to prescribe better treatments and drugs and dosages that make sense for their demographic. So we're talking about individualized medicine that's getting even more tailored and more specific around what's going to be the best fit for a treatment plan or a drug for you versus we just have a bunch of data that we use that doesn't fit the demographic that you're a part of. But that's a large amount of data that we have, and we're going to run different types of tests on different drugs and treatments on that data pool. For me, that doesn't really work. The data pool that research institutions primarily have, I don't fit into. A lot of that data comes from middle-aged Caucasian men. And those are typically the ones that are able to afford to go to the doctor, the ones that are typically able to have access to different healthcare
Good
services.
point.
And and for me, it's like knowing that a drug that they might prescribe me was only tested on that demographic. I don't know how that's going to affect me. And all of these things can come together to create just like a more tailored, more personalized experience when it comes to our health and wellness.
And not to mention get paid at the same time.
Exactly, because we know that healthcare, they're not hurting for any, they're not hurting for money, right? These drugs and treatments that are developed can only be developed because of the data that we are able to give them. They're only as good as the data that they receive on people. So if they're already creating an industry where it's $1 trillion industry, the healthcare industry, where you are part of that and you're already consenting to give your data, why shouldn't you receive a cut of it? Why wouldn't you get paid?
Yeah, and the data that's being collected is very specific. The pharmacy companies or the healthcare organizations can look at that data based on a specific age, gender, location. I'm sure that if they're paying for this data, they're receiving a lot of details from that participant, correct?
Yeah, but that's where the cool part comes in because you get to authorize what you're going to share
Okay.
about your data. So
Okay.
yeah, so
Okay,
even though,
good.
for example, something might be in your medical record, if you don't want to share that, you can just uncheck the box and say, I don't feel comfortable sharing that.
So, Britt, is there a way that this could be generational? For example, if I participate in this program, want to hand it off to children so they have access to their medical history. Now you're looking at generational history, not just yours, if that makes sense.
Yeah, it makes sense primarily right now because there is a payout element with it. To be
Hmm.
part of the platform and to participate, you have to be over 18. But
Hmm.
generationally can go
Yeah.
the other way. Your grandparents or your parents
Yeah, exactly.
can sign up and they'd be able to have all of that data aggregated in their profile. And yeah, since it's very specific, like I said, we only focus on EMR and genetic data. It's really good stuff to all have in one place, especially if it's going to influence your health outcomes in the future.
My next question is about privacy concerns. You gave some points about how the data is very much based on the individual's permissions, what they want to share. But is there any other characteristics of this program?
So we do go through very rigorous security auditing and privacy auditing of the platform. So we do follow all of the major compliances that are required in the countries that we operate in: HIPAA compliance, SOC 2, Type 1 and Type 2 compliance, just to name a few. And so from a regulatory standpoint, we take data privacy and security very seriously.
So it's completely private based on the participant and what they would like to share. They could go as little as just sharing very basic information to sharing a lot of information. Would that also have an effect on their income potential?
No, it wouldn't. You have the
Mhm.
ability to either contribute your data de-identified, or you can contribute your data and have it be something that you'd want to have that interaction with the researcher, right? You could authorize the researcher to contact you for additional information or to be part of a clinical trial or a study. So we have a broad spectrum of whether you want to share your data and be recognized or whether you don't.
Wonderful. And is there a average income potential that you can share for someone that might be watching and listening and they wanted to make a difference in the world as well? It's not just about the money, because this kind of opportunity is that you could be helping countless people in the future get better health service. So it has some weight on that side as well. But just on the income side,
Yeah, as of right now, each time your data is sold, you will get $40. And so that's each time it's purchased by a research institution, you can count on $40 hitting your bank account. And it doesn't necessarily matter if you are somebody who is suffering from a rare or debilitating condition that is interested in being part of the clinical trial landscape, or you're somebody who might be on the other end of the spectrum, a college kid that's looking to earn some extra income passively by just contributing their data and having a clean bill of health. Um, all data is welcome and it's all useful when it comes to translating into different types of health outcomes.
great. What is your average on a monthly basis? Someone that actually would even look at your data or purchase your data? Is it just based on what the scientific researchers need to have their criteria in their dashboard to see who matches that criteria so they can purchase that data? I'm pretty sure that's how it works for
Yeah, yeah.
yeah.
And it is a random sample, right? Even though you are
Okay.
part of a data pool and they can search
Yeah.
for specific parameters, whether that's around
Yeah.
demographics or different conditions,
Yeah.
it's all random, right? So you'd be thrown in a
Oh,
pool with, yeah, you'd be thrown in a pool with a bunch of other data points that match what they're searching for.
yeah.
And then it's basically a
Perfect.
lottery system on if you get picked. Yeah.
Yeah. Okay. So there's no name shared. The individual's name is not shared.
No, unless
No,
that's
that's
something
great.
that, yeah, unless that's something you authorize.
Oh, okay. That's also an option. Can you share a specific example that comes to mind where your platform helped benefit both the user and the researchers? Your
Sure.
platform. Yeah.
Sure. In working with one of the cases and working with an academic medical center that primarily was doing cancer based research, they were able to purchase de identified data sets from our platform to augment some of the data that they already had on existing populations. So that's one of the use cases. Another one is the purchasing of data to train de identified data to train different types of medical AI tools. And there's a really wide variety of different cases that the data can be used for. And it doesn't always necessarily need to be identifiable.
Okay. Yes. But as you progress years to come, most probably you're going to have a lot more data for your specific organization and what kind of impact you're making in the world.
Yeah, and that's a
Yeah.
really good point that you make because the functionality as we have it in the platform, we started testing that, got our security certifications and credentials at the end of last year, which was Q4 of 2023. And this is still something that is new to the market as we talk today on April in April of 2024. And so as we continue
Yeah.
to build out our user bases on both ends,
Mm.
it'll be really interesting to see what the data continues to be used for. Another use case that I'll give is
Yeah.
working with clinical organizations to be able to screen and vet patients that might qualify for a certain trial or study. So yeah, quite a few things.
Britt, I get so excited when I get guests like you on the show, because what you created, the innovation that you're presenting to the world, and at the other end, it's needed. It's unique, it's needed, and you're helping people earn. That's great, because now the person who's earning is also participating in making a change in the world. What you created as different angles to it.
Yeah, yeah. No, I appreciate you saying
Yeah.
that. And that's the thing. It's
Yeah.
trying to make healthcare and availability of that more
Yeah.
equitable, but also paying people what's fair based on how we use those types of data in a very real world sense.
There must be someone in the audience that's watching this or listening to it and say, "Oh man, I wish I had this idea."
Well, I was going to say it took a long time to get to this point. It took essentially my entire career to figure out how are we going to do something that could work, right? And we're still very early
Mm,
on. We'll see what happens, but I'm hopeful. I'm hopeful that we can make an impact and we can make a change.
mm. Are you going to add gamification to it?
In the future, yes, definitely. I
Okay.
believe that we've got plans down the road, but I
Okay,
don't want to
good.
put my dev team in a
Yeah.
difficult position.
Yeah. Yeah, that might be a good direction to evolve into. Everyone likes a challenge,
Yeah,
some sort, in the
definitely.
gaming world. And you like challenges. That's what I saw on LinkedIn. I always ran away from challenges my whole life. I would pray and hope that there would be no challenge, just everything be perfect. And I was asleep. I was just in a la la land to even believe that is possible, because challenges are part of life. And the key is to build a relationship with the meaning of challenges. When they come in our lives, what are they meant to teach us or provide us? That's the key. That's what I learned. So I want to ask you, in your world, that you enjoy challenges, you enjoy new ideas, new concept, new something to learn about. How do you go about managing those challenges when they first arrive in your world? How do you look at them? And then if there's any steps that you have, how you deal with the challenge when it does present itself?
Well, I think that's a really good question. I think the first thing is being realistic, that knowing that it's like you shouldn't ever expect there to not be any challenges.
Yeah.
Already have the mindset that you're gonna face a roadblock. It's not a matter of if,
Yes.
it's a matter of when. And
Yeah.
that's gonna help a lot when you come across those situations. So when I do come across a challenge, that's something that I I typically like to think about, take some time, figure out, all right, what might be the best way to go about solving it. I like to solve challenges fairly quickly. If I know that I have a challenge that I'm facing, I try to put a plan together or figure out how to do that sooner rather than later. I'm more of a eat the frog earlier in the week versus later in the week kind of person. And so when I do come across challenges, I don't just rely on myself and the experience that I've had, but I also rely on my community, because getting different perspectives from people you trust in those situations can really help shape the direction that you take. And so I rely a lot on my mentors, I rely a lot on my colleagues, and I rely a lot on my team. It's essential, especially when you have a small business and it's a startup and you're starting to grow. Um, that's
Great.
typically how I face those challenges. Yeah.
Great. Love it. So you mentioned mentors. So what percentage would you give to the fact that ask for help from mentors in your past that you would say have a direct impact on the success that you experience today in your life?
I would say the percentage is pretty high.
Mm.
I'm somebody that I believe that if you are someone who truly wants to learn, who really wants to create the best outcome for situations, you're going to acknowledge right away you don't know what you don't know. First of all. Second of
Mm.
all, you have strengths that you have that you're like, okay, I feel very confident doing this, but you're not going to know everything and you're not going to be strong in everything.
Mhm.
So being able to find
Mhm.
mentors to supplement that for you, that's been something that's really helped me. So I would say like, some of these challenges, because there are people that have been in this healthcare industry primarily in clinical research and trials and for decades longer than I've been, and so I rely on them when I come across these challenges. And so I'd say mentorship, yeah, I would say probably between maybe like 25 to 50% of the time I'll go
Mm.
ahead and just bounce something off and then
Mm.
take that and run with it. But yeah, my mentors, I
Mhm.
definitely talk to them every week, if every other week, if not every week.
It's the key to ask for help from someone that's already somewhere where you want to be. It just speeds up the process
Mhm.
incredibly fast. And especially that guidance that you get is not just the specific guidance you get for that situation or that circumstance that you're dealing with, but it's the overall guidance that you may receive. The way you think is also improved by having another expert in your life guiding you. So
Definitely.
It was great, Britt. It was wonderful having you on the show and speaking to you. Appreciate your time today. I wish you all the best, continuous growth. I'm definitely going to take a look at your platform as well and share it whenever I need be, because the more people have this, the better it is for everyone. So, I love win situations. So, thank you
Yeah.
again and keep in touch.
Thank you so much for having me. And I love win situations too. And so really
Yeah,
appreciate it. Thanks for the conversation.
my pleasure.